I've never heard that before. That was very kind of you because people love to hate me. It's true.
Awesome.
I hear it all the time. They say, don't take this personally, but I hate you. How am I not supposed to take that personally? I mean, personally, I don't think that's fair because I don't hate them. I mean, I like to think that I care for them because I'm a health care provider. So my job has a social challenge, and in the social sciences, it's called a conflict of perception. But I understand where their perception comes from because, after all, I am their dentist. And I've been trained in the physical sciences. So let me explain to you how this works in healthcare. Doctors are taught a strategic approach to curing disease. It goes like this. The first thing we do is we look for external physical signs and symptoms. Having found those, then we look under the surface for the internal manifestations of physical causes of the same disease. And having diagnosed it properly, which is key, then we apply the physical arts to heal them. Sounds pretty simple. I only do those physical sciences 2 days a week. The rest of my time is devoted to the social sciences, specifically the social psychology of group dynamics and conflict resolution in the workplace. And when you can walk on both sides of the scientific spectrum and you can combine the strategies of medical science in the physical realm with the sciences of the social sciences in group dynamics, then you can cure a lot of conflict. And that's our goal today, is to teach you how to solve conflict. If you go back to that 3-tier approach I showed you with the medical sciences, there's a social science, and it's parallel. It goes like this. The first thing we need to do is define what the problem is. Second thing we have to do is determine the underlying or root causes of the problem. And then all we need to do is address the root causes until the problem is cured. Now, if we can agree that there's a conflict of perception where people say they hate their dentist, I can tell you as a social scientist, there's a much larger conflict of perception where people say they hate their job, hate going to work, and even hate their boss. Now, that's a problem. And our research has shown that if you're a boss or anybody responsible for the care of anybody else, then you know what? You're kind of like a doctor. Because as a doctor, I have to give people recommendations and instructions that they're supposed to follow. And if they do, it's in their best interest for their long-term health and welfare. But all too often, patients don't follow doctors' recommendations. Why is that? Well, I'm going to give you an example of a true conflict of perception that I deal with on a regular basis with young adults, where I've got their best interests at heart, and if they follow my recommendations, it's going to be good for them, and if they don't, they're going to suffer. And yet all too often, they ignore my recommendations with respect to this: getting their wisdom teeth out. If you look at this, this is a horizontally impacted wisdom tooth. And if you look at these red diagonal lines, they demonstrate how this tooth is covered in some of the densest bone in the body, which begs the question, how does a surgeon get these out? Let me tell you, it's like pulling teeth. So I'm going to show you this step-by-step approach, and I want you to remember the sociological 3-step approach. See, the first thing we have to do is define the problem. Well, the problem's right in front of us. You can see it in the x-ray. The second thing we have to do is we have to get under the surface to find out what's causing the problem. And the way we do that is we remove the bone so we can see the problem. And once we can see the problem, then we need to remove the head of the tooth. And now we have some space to work in. I call that getting into the head space. And after we've done that, now we can deal with the roots of the problem. And once the roots of the problem are dealt with, guess what? The problem's gone and the patient heals. See how simple the surgery is? And it's painless. Until you go to the front desk and pay your bill. So I have a physical question for you and a sociological question. The physical question is, if this is something that every young adult needs to get done, then why is it that so many young adults ignore doctors' recommendations when we've only got their best interests at heart? Here's a sociological question. Why is it that so many young adults, and by the way, I was once a young adult, why is so many young adults ignore the recommendations made by older adults when the older adults only have their best interests at heart for their long-term health and welfare? Well, when you combine the physical sciences and the social sciences, you can find answers to this. And 20 years ago, I was asked if I would serve on the board of directors for the world's largest private dental education organization. Not because I was a dentist and not because I was an educator, but because I had a background in sociological research. And they wanted to apply that because I could speak dentalese. So I was able to design and supervise a sociological research project. We have to define the problem. Well, the definition of the problem was the perception of the public that they didn't like going to the dentist, and the perception of the dentist that we're only trying to help them. So the title of the survey defined the problem. It was called Your Dentist, a Love-Hate Relationship. And we gathered data for 4 years. And when we crunched the data, on one hand, the public told us that their perception was we were highly educated, highly trained, and highly skilled. And that was great. But on the other hand, they said that they felt that we didn't care to care. In other words, they were effectively saying to us, it's drill, fill, and bill. And that we were just physical specimens. And that was disappointing. And that was discouraging. So that created a challenge and a new conflict of perception. Because this was an education organization, and they wanted to devise an educational program to help cure this conflict of perception. Well, how do you tell a number of doctors that your patients think you don't care for them? From the social sciences, we all have a self-defensive or self-preservationalist attitude about ourselves in terms of group dynamics. And it's this: I'm okay. I'm okay. You're okay. You're okay. We're all okay. So for me to be able to explain to my colleagues that, no, the public thinks you're not okay. As a matter of fact, the public thinks there's something terribly wrong with you. Well, self-preservation wouldn't allow us to accept that. And that's exactly what happened at universities and workshops and conferences. You got to remember the three-step approach. Define the problem, then you have to find the underlying roots. Well, the public told us what the underlying roots were. They were very specific. These are the ways that we feel you don't care for us. But you see, if I'm not prepared to receive that type of perspective, if I want to believe in only my own perspective, that I'm okay, then I'm never going to get to the third stage, which is the curing stage. And I understand why my colleagues were hesitant to accept what the recommendations were. And yet, ironically, for the dentists that did prepare to accept this, we devised some protocols that they could follow. And this is what we devised. We said, you know what? If the public is saying that we're not caring for them, then what does the word care mean? Well, let's define the problem. Charles Kettering had a famous quote. He said, a problem well defined is a problem well solved. Well, how do you define the question, do doctors really care in healthcare? Because I don't care how you define it. In medicine, if you misdiagnose something, you can never cure it. So you know what? We can't be careless, or worse, careless. Instead, we have to be careful, because the word care has six different definitions, and I just use 4 of them. Here's one definition. You're welcome. Here's one definition for care. It's the provision of services for the purpose of the protection or maintenance of something. Think daycare. Think caretaker. And if we apply that in the health sciences, if we're only focused on the physical, then maybe doctors should call ourselves health services providers, because that would be accurate. Because in order for us to qualify as caring health care providers, then we'd have to use a different application of the word care. And that application goes like this: someone who expresses genuine concern and sincere empathy, who puts the energy, emotion, and effort into being focused on this other person in terms of what they think, say, and feel. That's care. Guess what, everybody? That's not taught in health sciences. See, health sciences, you get accepted based on your grade point average. You want to apply to medical school? You better have a pretty close to 90% average in some of the toughest undergraduate courses that exist. If you go to a local university, which will remain unnamed, and you look at their website, they say, if you apply to our medical school, if you have these high grades, give us 3 names and we'll phone those references and we'll interview them for 10 or 15 minutes. I just gave a reference for a young adult that I've been mentoring who applied with BC Transit. That interview took 45 minutes. He was applying to be a bus driver. There's a problem with healthcare. Dr. Francis Peabody identified this very succinctly when he was addressing the Harvard School of Medicine. He said, in presenting a paper that was published by the Journal of the American Medical Association, he said, in the care of the patient, that all too often modern medical students are way too scientific at the expense of being humanistic. He said that the secret of caring for the patient isn't caring for the patient. And he spoke to the modern medical students about that in 1927. We haven't changed. Now, if there's a problem with doctors caring, I'm going to suggest to you as a social scientist, there's a much broader problem. This is what we stumbled upon when we did this research in Your Dentist, a Love-Hate Relationship. And what we stumbled upon was a social problem that has great socioeconomic ramifications. And it has to do with whether or not people like their work, like their job, or maybe hate their boss. Because I don't care how you slice it, to say that you hate anything can't be good for you or the person you supposedly hate. This is called disengagement, and according to the research, disengagement is what medicine would call an epidemic. It affects 85% of employees. Socioeconomically, it comes at a cost of over $7 trillion a year to our global economy. Why haven't we cured disengagement? It's been around now on the books for over 20 years, according to Gallup's research. I'm going to tell you why. Because it's always been looked at as an economic problem. I'm going to suggest to you it's a social disease. I'm actually going to prove to you that it's a social disease. You see, in medicine, if we don't look after people mentally, emotionally, and spiritually, if we only look after them physically, which is how we're trained, then we're not looking at them holistically, because holistic medicine is defined by mental, emotional, and spiritual, as well as the physical. But mental, emotional, and spiritual, everybody, these are social skills, and social skills are taught in healthcare education. Because we accept students based on their amazing GPAs, what we're doing is we're saying that we're worshiping IQ, intelligence quotient. Why aren't we looking at their emotional quotient? Personally, I don't want a doctor who's a robot. I want a doctor who's going to listen to me. And I can tell you as a doctor, if I don't listen to my patients, and if I don't allow them to ask questions, and if I don't answer those questions in English that they can understand, I am going to misdiagnose the problem. This is not taught in schools. But it's not taught in the corporate world either. You know what the corporate world teaches? The corporate world teaches that profits are more important than people. I'll prove it to you. You see, as it relates to disengagement, they define it as an economic problem. They say that our people should be more productive. Why? Because we give them a paycheck. That's just physical. What do our corporate entities do to look after people mentally, emotionally, and spiritually? Here's an interesting definition. The word corporation comes from the Latin word corpus. Corpus means body. We know in medicine that if the parts of the body aren't healthy, then the body itself isn't healthy. Well, if the parts of the corporation aren't healthy, how can the corporation be healthy? The parts of the corporation are people. People are our most valuable assets. Unless you just want to treat them physically, which is the problem that we researched in Your Dentist, a Love-Hate Relationship. But the problems are parallel. See, the thing with millennials, and I hear this all the time, because I have so many people that I deal with, either in the consulting end of things or the dental practice end of things, where they complain about these young millennials, they don't know what a work ethic is. Well, no, that's not true. They've never been taught what a work ethic is. And just in case you think that, no, it's the problem with the millennials, if you're a baby boomer, think about this. Didn't our parents have a conflict of perception with us? No, think about it. We were the flower power people. Remember that? Okay? We were hippies. Remember that? We invented disco. There's always a conflict of perception. How do you solve it? Here's how you do it. There's like 2 steps. The first thing we do is we sit down and we listen. That's what I have to do with my patients. and allow them to express what they're saying, thinking, and feeling. And then I have to give some serious consideration to whatever it is they say, think, and feel. And then we need to sit down and reason together. I can just be the doctor and say, why are you worried about this surgery? Kids go through it all the time. I've done thousands of these. Don't worry about it. That doesn't look after them mentally, emotionally, and spiritually. But when I take the time to do it, an amazing thing happens. They start to trust me. And in medicine, we're taught to create a bond of faith and trust. The most important thing in medicine is to create a bond of faith and trust. We were told that Mondays, Wednesdays, and Fridays. On Tuesdays and Thursdays, we were told, and you must maintain the bond of faith and trust. And then they never told us how to do it. Yay. You know how you create a bond of faith and trust? Look after people holistically. Do you know where we have a problem with disengagement? We have a problem with disengagement because sociologically speaking, millennials lived through a time, especially in the 1990s, where the corporate world had a new philosophy. It was called lean and mean. And we're going to cut expenses so we can raise profits. Wonderful. We are going to raise profits by laying off people. On one day in 1994, Ford laid off 18,000 employees. That affected 18,000 families. Listen to this. It affected the children, millennials, of 18,000 families. And that was a drop in the bucket. This happened all over the Western world. These were hundreds of thousands of people that were laid off. And now the children watched their parents be discouraged and even depressed. See, the children would be saying to their parents, Mommy, Daddy, how come you're always at work? And that's because us baby boomers want to do something different than our parents. Our parents lived through a depression, so they saved money. They never spent it. Us baby boomers are going to spend it on our kids. So we'd say to our kids, oh, I just worked this hard because I care for you. Try to get an 8-year-old to equate their parents' absence with care. That's a conflict of perception. But when this happened to their parents where they lost their jobs, see, they weren't stupid, and millennials are one of the most intelligent generations we've ever seen. The millennials put the blame where it belonged, with the corporate world. The corporate world, that put profits before people. That put profits before their parents. And by extrapolation, the corporate world put profits before the millennials themselves. You wonder why we define them as job hoppers? Because they're looking for an environment where they can make a contribution and feel that the company actually cares for them. That's why. And they'll keep job hopping until they find something that resonates in them, because they're not robotrons. They're not there just for a paycheck. And we need to understand that by diagnosing it and getting under the surface. There's 7 sociological reasons why we're having a problem with disengagement, but it's always been taught that it is an economic problem. Well, it's not. If mentally, emotionally, and spiritually we're not at ease, then we have social dis-ease. And we can cure that by doing 2 things. We listen to each other. We consider each other's perception, because there's a conflict of perception. And then we sit down and reason together. And we determine how we can address these root causes. And when we do, we will defeat disengagement, as long as we're prepared to take the time and give consideration. Thank you for your time and your consideration.